Hi, my name is Terry Roberts. I'm Chief People Officer at Oxford University Foundation Trust.
Hello, I'm Sharon Gregory, Divisional Director for Older Adults and Specialist Services at Surrey and Borders Partnership NHS Trust. So Terry, it's lovely to see you today. Just got a few questions for you, and let me start with asking you what attracted you to work within the NHS?
I think it goes back to some time ago when I was doing my dissertation for my Masters in Human Resource Management, and I did a comparison between reward systems in the NHS and in the private sector. And I saw that whilst the NHS might not have paid as much as the private sector, the work was infinitely more rewarding. And I could see that you had more responsibility and that you could contribute to improved patient care. So for me, that was the attraction.
Okay, so how do you and colleagues generate great ideas in the organisation and within your teams?
So we have a system or a process that we call huddles. So we build on each other's idea. Our exec team and my teams, we have weekly huddles where we discuss what went well, what didn't go so well, and what we could learn from and do differently. And this generates great ideas, which we all build on and then look to implement.
Okay, so how's the NHS supported you to grow and develop in your career and get to this point?
So I've benefited from many courses over the years, both professional and developmental, such as the King's Fund Top Managers Programme. But I would say that around the support I've received from mentors, allies and coaches, that has enabled me to get to where I am today.
And so what roles have you had along the way?
I've had many roles. So I started off as a personal assistant, and for those of you who are as old as me, you'd know that actually that was, what we used to call people or HR back in the day. So I started off as that. I've worked in recruitment, I've worked in employee relations, workforce planning, equality and diversity, organizational development. I was a HRD for many years, and I've been working at board level for the last 8 years or so.
Yes, so that is extensive experience, giving away your age there almost. So tell me...
That sounds good. You're flattering me, I'm sure, but I am an old man.
We all get old. But tell me about a mentor who helped you during your career, and how did they support your progression?
When I think of probably my biggest mentor, she was somebody who saw my potential. She even invited me to come and work for her. She helped me get a national role working in the decontamination team back then. She prepped me for my first HR role, and she still gives me advice to this day.
Gosh, that's really good. So how do you continue to grow and develop as a leader?
Well, I think it's about being open to new things. I'm always seeking to make things better for our people and our service users. And that drives me to seek out new and old ways of doing things, making improvements, be that meeting people or networking or courses.
And so what talents do you use in your role?
I'm not sure that I have talents.
I'll stop being modest.
I know, seriously.
Tens and dozens of them.
No, but what I would say is that I am determined to improve things, and that determination has helped me to get things done.
Okay, so what do you find the most rewarding and meaningful in your current role?
So for me, it's around developing talent and making a difference for our staff and consequently our service users. We've kind of developed a program called Growing Stronger Together, and this is an example of where we help people recover from the pandemic and then move forward, so that they have healthy lives going forward and that they want to stay in the NHS.
So who inspired you along your journey, and how did they do that?
So I would say it's the mentor that I talked about earlier. She taught me many things, but also how to work with unions, how to be a compassionate leader, and how to put people and services first.
Yeah. So what advice can you share with people aspiring to be a senior leader in the NHS or indeed the wider system?
So that's a really good question. So I think it's about identifying and developing your strengths. And I think if you build on your strengths, I think that will help make a way for you. I think it's also about treating people how you would like to be treated, living out your personal values and seeking to improve the lives of those around you. I'll also say it's really helpful to understand your own drivers and motivations and be emotionally aware of your impact on others.
If you could advise two things to yourself at the start of your career, what would you say?
So I would say, don't let negativity hold you back, and don't stay in roles that don't appreciate your worth.
Yeah, that's really helpful advice. So what is the most important risk you've taken and why?
So I'd probably say moving to my current role. It was, I'm a Londoner, I've been based in London all my life. And so moving out to Oxford was a little bit of a risk for me. Also, people warned me not to come here because of the issues that were long-standing and embedded. But I wanted to make a difference for staff and patients. And I think that with the team we have and we are making a real difference.
Good. And so how do you maintain your health and well-being at work?
So even though I don't look like it, I do exercise. I also talk to others who are going through similar things, and I pray as well.
Yeah, no, that's really good. And so what advice can you share with other users to maintain their own health and well-being and occupational balance?
So I would say, don't prioritize work over your family. Take all of your annual leave, talk to others, and don't feel ashamed to speak to counsellors or others that can help.
Yeah. And what challenges and barriers have you personally faced along your journey, and have you overcome those?
So I've faced discrimination along the way, but I've been determined not to let it hold me back, and I've sought help and advice from others and consequently left those environments.
Okay. And so what is your advice to colleagues on how they can progress to senior roles?
So I would say, first of all, look at essential and desirable criteria in the person's specifications for those roles that you're interested in. I would say then undertake a gap analysis of yourself and against those criteria. I'll then say seek to get experience in those areas that you have gaps. Speak to people who are already in those roles and those who employ people who are in those roles, so that you can get an insight into what the real requirements are of those roles, not just those that are stated and written down.
Yeah.
And then I think that you need to build it into your personal development plan and make sure you get an agreement so that you can get experience in those areas as well.
Okay, well, I've really enjoyed our little chat. There's loads more that I'd love to ask you, but I recognise you're a busy person, and I just want to thank you for taking the time to just, share with me some of your thoughts on those things. So thank you, Terry. It's lovely to see you again.
Well, it's a pleasure. It's a pleasure to meet you, Sharon, and thank you.
Thank you.